Hello, I'm Dr. Sri Banerjee, core faculty from the College of Health Sciences and Public Policy. And in this segment, I'll be going over a concept called drug diversion. And drug diversion is a serious public health problem. Once you understand what it is, you'll know too that it is a problem. The most common types of drug diversion? Well, the most common types are as follows: selling prescription drugs, doctor shopping, illegal internet pharmacies, drug theft, prescription pad theft and forgery, and illicit prescribing. So all of these together are, in fact, very detrimental to not only the person but the society that they're living in, and uh, tries to some of these drugs try to, and some of these techniques try to get in the way. So, what are the classes with a high potential for drug diversion and abuse? Well, some of the classes include anabolic steroids. Now, that's different than the steroids that you take within uh, the. That's different than the steroids that you take medically. So, for instance, like a Medrol pack, that's not anabolic steroid. That's steroids to help you get through pain and other things. And then central nervous system depressants, hallucinogens, opioids, and stimulants. So these are the four following classes. These are the five classes of prescription drugs that have high potential. So the prescriber precautions that can minimize drug diversion, while exercising caution with patients who use or request combination or layered drugs, documenting thoroughly, keeping a DEA or license number confidential, so that will prevent forgery. Moving in electronic prescribing so that paper prescriptions are not required. And the reason electronic prescribing is so convenient is that when you have one sort of condition, then everyone will know immediately that that is the condition. And then adhering to strict refill policies and educated office staff, using state prescription drug monitoring programs. And these are having good effects and are seen more frequently. Referring patients with the need for extensive pain management or prescription controlled medication to specialized practices. So making it more so that disease can be manageable. You don't want to get rid of pain, uh, but not illegal practices. So that's there's some pill mills. They call them pill mills down in Florida, whose purpose is to prescribe pain medications, and these practices are not healthy for the society or healthy for the person. Some of the more famous stars' deaths actually are taking place due to misguided prescribing techniques. So, prescribing, so there's a couple of more actually in the other part of this. And then prescribing principles that can curb the diversion of drugs. Well, prescribers can curb drug diversion of opioids and other controlled substances by adhering to prescribing principles. So, completing a full evaluation and assessment, requesting a report of a person's medication history, screening for substance use, prescribing opioids, and using pain management tools. So, all of these, if they're used effectively in balance, in balancing everything, if it's used effectively, can help curb the pain, but at the same time can curb any sort of addiction. So, reporting suspected drug diversion, there is actually the DEA, and there's actually Office of Diversion Control website, and any type of theft or loss of controlled substances. Um, and this is something that has happened from experience, uh, and so when some of these are stolen, then you have to be cautious, and lock doors, things like that. Um, so additional resources out there, over here, there's some good ones. Uh, by CMS, that's Medicaid and Medicare coordination, and then fraud prevention. And then there's others through SAMHSA and some other websites you can take a look at in order to understand drug diversion, or the principle and concept of medication or diversion as well. The well-known concept is drug diversion. So hopefully this makes sense. Thank you for listening.